Welcome to Mental Health Now. My name is Kim McDevitt, and I am the Executive Director of Health America of Lancaster County. Today, we're talking about suicide prevention. With us, we have Mark Schantzer, who is President and founder of the DES Foundation. We have Elaine Ostrum, who is the Director of Pathways Center for Grief and Loss at Hospice and Community Care. And we have Dr. Pia Fennimore, who is the Vice Chair and Chief of Pediatrics at Lancaster General Penn Medicine. Welcome, everyone.
Thank you.
So we're heading into Suicide Prevention Month. September is Suicide Prevention Month. And this is a very important topic. At Mental Health America, we're doing a lot around suicide prevention. The whole community is doing a lot around suicide prevention. Mark, you started the DES Foundation many years ago in memory of your son, Desmond. Can you share with us a little bit about your story and why you started that foundation and are involved in this work?
Well, we lost Desmond June 6, 2011. He took his life in our backyard, and my wife found him. So, that rocked our world, my world, our whole family's world. To fast forward, my daughter found a walk to go to, and she thought it would be great for the family. We got shirts made, went to the walk. The walk was out in media. And when I got to the walk, I was so emotionally charged, I couldn't even say my name at registration. And all I wanted was to connect with other people, who walked in my shoes, who lost their son, daughter, whatever relative. And it was 200 people, roughly. They all stayed in their own groups, and nobody shared their stories. So I said to my wife, Debbie, as we're pulling my grandson in my son's little red wagon that all kids usually have, I said, we need to do this in Lancaster. And she said, whatever you want to do, I'm right behind you. So that Monday, I called Elaine. I told Elaine what I wanted to do. And I said, who do you call? And she said, you call Mary Steffi at MHA. And I called Mary Steffi, went through my story, and she said, well, today's my last day. And Jan Bailey was the ED at that time, and we were off. And we started, Jan said, and that was in May, and when next year do you want to do this walk? I said, no, Jan, this year. I want to do it this year. So we had a couple walks that were in like November, and then there's a doctor, I can't remember his name right now, from Penn that said, Mark, you got to do this in warmer months, but it was great. And it was what we did to connect people together is we give out different colored beads that will signify your loss, so that, Kim, if you lost your child and you wore blue beads and I wore blue beads and we didn't know each other, I might come over and talk to you because we have something in common. And it our walks brought about a space where it wasn't only expected, but it was okay to talk about suicide, because no one's going to talk about suicide walking up and down Park City Mall because of the stigma. So, I think we've helped a lot of people just get to tomorrow.
Yeah, and the walk actually transformed or transitioned into the Suicide Prevention Coalition. Is that
Yep.
right?
In the first two walks, we funded the Lancaster Suicide Prevention Coalition. We actually, we had someone come in who trained. We had big meetings and trained us all, and that's how it all started. So yeah, that was our baby. Our baby.
And yeah, our baby, right? So you talk a lot about the connection
Mhm.
to others, and that's one of the important, you know, tactics for preventing suicide. You also talked about the importance of identifying the symptoms, the signs and
Okay.
symptoms and warnings. And when we spoke, you shared that you weren't able to identify those signs and
Right.
symptoms in your
So
son.
to me, the most important thing is that to help stop suicide is for, it's like CPR. You see on TV if somebody's choking, you squeeze their chest and the food flies out, right? So people know what to do when somebody's choking. People should know what to do when they see the warning signs of suicide. All right, and it's on your cards, all the different warning signs, but also what to do when you see them.
Right. And we have the trainings, the QPR trainings,
Yep.
question, persuade, refer, and those trainings help folks identify how to have the conversation,
Mhm.
which is really tough, really. Asking, and Dr. Fennimore can speak to this. I mean, you meet with you're in pediatrics, so you meet with families and children, and it's difficult to ask those questions.
Absolutely, and I think that it takes training and it takes practice. And the important thing that people need to know is that if you're making an effort to do it, you're not doing it wrong.
Right.
So it's really a matter of people being willing and understanding the importance of it.
Right, and having those conversations is not suggestive, right? So
Correct.
Absolutely
and
not.
and that's one of the myths, right?
Mhm.
So if you ask someone if they're thinking of harming themselves, it's not suggesting to them that they
No.
should, right?
Yeah, we have a lot of research to back that asking and talking about suicide
Right.
does not increase their risk of suicide.
Yeah. So Elaine, can you share a little bit about what those warning signs could be?
Yeah, and so individuals that have a history of depression, past trauma, they're struggling with feelings of hopelessness, worthlessness, and they're isolated. That's often what's key, as you talked about the need for us to be connected with other people. Those that are isolated and withdrawing from others are at risk. Those who have lost someone else close in their lives to suicide
So
can be
contagion
at risk.
suicide, yeah.
Yeah, and just that they know it's not taboo. That it's a possibility of a way to end the pain that I'm in. People who are struggling with suicidal thoughts are dealing with what researchers call psych ache, intense mental pain and anguish that might develop after experiencing losses, broken relationships, maybe feeling an assault to their self-image because of losses and feeling a loss of control in their lives. So we recognize people that are in those kinds of situations to be able to come alongside them. For people now, our culture is so divided and there's a lack of connection. People are just having relationships through texting or on social media, and so don't have those close relationships to be able to turn to when we're in trouble.
We see that a lot with youth too, the lack
Yeah.
of connectedness and the skills to engage with one another in a deeper, more meaningful way.
Yeah.
Right?
Yeah, so that's one of the real
Yeah.
barriers in our community right now to being able to recognize and reach out, or for people to feel comfortable reaching out. Who can I turn to if I'm really struggling?
Also, it just keeps rolling in my mind.
Yeah.
At our walks, I've had the privilege of speaking to a lot of parents, and older people my age. And you see a lot of people in their 60s take their lives. And one of the big warning signs is maybe it's the husband or maybe it's the wife, but they're getting everything, all their affairs in order. They're getting their filing cabinet in order, their passwords to this and that. And why? Well, just so you have it in case you need it sometime. That's like a big warning sign because he or she has a plan and they're going to go do it. And that's where someone needs to step in and talk to them.
And for some, and you can talk because you have more the clinical experience, but and we hear that individuals who might be thinking or have suicidal ideation might have that sense of relief once they've developed a plan. And so you might find a period of joy. They become joyous and calm and, or more peaceful.
Yeah, that is true. But there's also a sense of relief when someone asks that question. And so I wanted to validate what you were saying about asking somebody directly if they are having thoughts of ending their life, because that's a secret that they're keeping to themselves. Maybe they don't want to let anyone else know because they feel like no one else would understand. And so to be able to ask that question directly, and that we notice that, I'm noticing that you're really struggling right now. Are you thinking of ending your life? That can be a relief to be able to bring that out in the open. So rather than planting the seed of that idea, we're giving them permission that it's okay to share your pain with someone, and that there are people that care, that I care. I'm concerned about you. I want to help you get help. And so that can be a relief for that person to be able to recognize that there are people that are caring about them.
So I think sometimes the hardest thing is to be able to identify when someone's struggling because of stigma, right? So that's why we're having these conversations. And I think since our pandemic, the one thing that came out of that is really bringing mental health and mental health awareness to the forefront. But so being able to identify is one thing, but knowing what to do thereafter. So having that conversation, right? And we have 988, which is the suicide prevention hotline. So 3 short digits, 988. People can reach out to 988. And so, there's a lot that can be done to prevent suicide. Now, we know that not all suicide can be prevented, but we are aiming for zero suicide in our communities.
I just wanted to emphasize, we mentioned 988. When people call 988, that's a hotline. They're getting a counselor right away. They're not going to be put on hold to hear some music and why somebody searches to find somebody. So it's the only way to get rapid response to what your needs are.
So it's the 911 equivalent, right, to mental health.
When someone calls and needs help, you call 988, they have a counselor on the phone. And the counselor on the phone is doing the background work to see what any police or anything they can get to come to your location. So real important.
Yeah, very important. Thank you. In the next segment, we'll be discussing how we are coming together to prevent suicide through firearm safety. Welcome back to Mental Health Now. Today we're talking about suicide prevention, which is suicide is a significant public health issue. And with us, we have Dr. Pia Fennimore and Elaine Ostrum. So Pia, you and I, or Dr. Fennimore, you and I have been recently reconnected to work on an initiative that's very important in our community to decrease suicide and other safety deaths in our community. Can you share a little bit about why this work is so important, what this work is?
Sure. So this work is that we're starting a new initiative in Lancaster County to really strongly educate people about the importance of firearm safety and to make firearm safety easier. So we're providing free gun locks, some access to discounted biometric gun safes, and most of all, just really getting people talking about firearm safety. The reason why this is important is that firearms are the number one cause of suicide, especially in youth. And more than 80% of youth who use a firearm to harm themselves get their firearm from a family member. And more than 50% of firearms are not secured properly. So we know that there's a lot of work to do, but we also really see that it can be impactful work. As a pediatrician, you liken this to a public health issue. You know, pediatricians, we spend a lot of time thinking about preventive care and really looking at the whole child and thinking about how they can grow to be strong adults. We talk about vaccines and we talk about nutrition. We talk about seatbelts and car seats. And I really consider firearm safety an issue very similar to that. It's a public health issue. I don't consider it a political issue by any means.
So we're not saying you can't drive cars. We're
absolutely
saying,
not.
yeah.
Just please put your seatbelt on.
Please put your seat.
So that's kind of where I think the pediatric world is looking at this issue.
So healthcare providers and firearm retailers, they can come together to collaborate to promote gun safety.
Yes,
Yeah.
I think that's two groups of people that rarely sit in the same room. Right. But yes, I think that they can collaborate and that everyone will win if they do. Nobody has any interest in limiting access. This is not about gun control. This is about firearm safety. And healthcare providers are very interested in collaborating with gun retailers because we know that they have the attention of gun owners. So we're looking forward to that.
Right. And this brings mental health awareness in as well. And maybe, Elaine, you can talk a little bit about that and what you've seen pathways and the importance of
that we want to decrease the stigma of having that conversation with people. I think so often people are afraid to ask that question of, are you struggling with depression? I'm sensing those feelings of worthlessness and helplessness and hopelessness. And are you thinking of ending your life? It's important to have those conversations, to ask the direct questions and ask if they have a plan, if they are thinking of ending their life, or at that point to ask, do you have a plan? Do you have an access to a firearm? And to make sure that it is secured, make sure that other family members are aware. Who else knows that you're struggling? Have you talked about that with your family members, with your doctor? Who else can come around you for support? Are other family members aware of the risk here to make sure that firearms are secured?
And Dr. Fennimore, you're doing a lot of work with pediatricians, but also emergency departments.
Yes. So this initiative, we're collaborating with pediatricians, family medicine providers, emergency department providers, and even our trauma department is very interested in this because, of course, they see firsthand the effects of firearms. And to jump in on what Elaine said about mental health awareness, the way we sort of think of this very abbreviatedly is lock and talk. So actually, the firearm safety component of this, the public health component of this, is a great way to start a mental health conversation. Do you have firearms in the house? Are they locked? Have you considered that that locking and securing your firearms can help prevent suicide? Is there anyone struggling with mental illness in your home? So it's a great way to actually start the conversation.
And it's more preventative, right?
Absolutely.
So, and how are you, so your families, how are they, when you have these conversations with them, are they receptive?
Yes, I actually think that a lot of healthcare providers hesitate to bring these issues up, and we're doing a lot of education with providers around that because they think they're going to get pushback from families. But if you really come at it from a safety approach, I never get pushback. And in fact, families often are really interested to talk about it. And it's fascinating to me how often there are some misconceptions that I'm able to clear up for them about firearm safety. So I really am looking forward to getting more healthcare providers comfortable with this topic.
That's great. And how can firearm safety education be improved in our community? So you're starting with the providers, right? The medical provider group. And what else could we be doing?
Well, one of the things that we've done is we've involved the Sheriff's Association in this initiative, because I think that our law enforcement providers are trusted individuals in the firearm community, and so and they also are the first responders and see a lot of the devastation that suicide can cause. So we've really been valuing their partnership, and they're working with us to provide firearm safety classes, as well as education when people come in to get their permits and things like that. So that's one collaboration that I think is going to make a big difference. And then I just think drawing attention to this issue in any way that we can, doing what we're doing right now, is the most important part.
That's wonderful. And we are distributing gun locks at
Yes.
MHA in partnership with
That's
Penn
right.
Medicine and the Sheriff's Department. And we want anyone who has firearms in their home to be able to access. We can provide those safety locks and the biometric boxes as well. And actually, as you mentioned, gunshot is the means for the highest rates of suicide.
Yep.
And so if we can prevent that, decrease that, we're doing a great job in our communities. But again, having the conversations, reducing stigma. And it's not just youth, it's not just children, but it's middle-aged white males
All
as
walks
well.
of life.
All
All
walks,
walks.
non-discriminatory.
Yeah.
And again, having those times of transition in a life, those very difficult times, and so being able to open up the conversation.
Yeah. You mentioned the first responders that you're working with, and I just want to reference first responders as a high-risk group
Absolutely.
for suicide. They're experiencing trauma every day on in their workplace and witnessing horrific things that they carry with them,
Yep.
and often then are afraid to ask for help, because I'm supposed to be the strong one here in the room. But so then they go home with no one else to talk to, because there's that image of, I can handle this.
Right.
And so
Or I
often
should be able to.
so
right,
a fear of reaching out or sharing that with any of their peers that I'm struggling. And so I think that's an important piece for peers to be able to have that conversation of noticing a fellow firefighter, police officer, another first responder that has just been through a difficult circumstance with a terrible accident or violent situation that they might have been involved with, providing support to check in. Hey, how are you doing with that? Maybe they were responding to someone who had a child of a similar age to mine, and whatever kinds of things might be staying with them, to be able to offer that support. And first responders have access to firearms. And
Right.
so, again, part of that high risk group. So
But what is it about the gun safety that prevents suicide? What is it about
It's
locking
about
up your
time.
gun? It's about time.
It's just about time,
Right.
because we know from interviewing people who have had attempts on their life or self-harm, that these thoughts are often very fleeting. These thoughts are often very responsive to talk. These thoughts are often very responsive to interventions of any kind. And so if a firearm is secured properly and they can't access it quickly, there's that time element that you need to prevent that suicide.
That's very important. And I think that is why we are distributing these gun safety locks everywhere. It's that time, the few seconds that it would take to unlock a firearm, the 10 seconds that it might
that
take.
it may be an impulsive thought to reach for that gun.
Yep.
So how can we balance, we talk about firearms and the rights to firearms. How can we balance the rights of gun owners with the need for increased safety measures to prevent suicide? And you talked a little bit about that.
So I think as long as we continue to think of this as a public health issue, which is 100% what this is, we can realize that we're all on the same side of this
Right.
this one, for sure. I think if you talk to any healthcare provider, we all respect the Second Amendment. We understand that it's a very important part of our country's history. It's an important part of our culture. Nobody's interested in questioning that at all, actually. What we're really interested in is coming together to prevent deaths that shouldn't happen.
Right.
So,
Can be avoided.
Yep.
So, wow, this was a wonderful conversation. I thank you both for contributing and doing this very important work in our community to prevent suicides.
Absolutely.
thank you.
Thank you. Let's keep the conversation going.